Thank you all for giving me this opportunity for a lightning talk. I'll try and keep an eye on time. Um, I think some of you know us reasonably well, and others probably not at all, but the Global Alliance for Genomics Health is a very similar mission, values to RDA across the scope of your work. We started almost at exactly the same time, so we celebrated our 10th anniversaries together. Um, and the way I've always kept it separate in my mind is RDA's got this commitment to open science and research data across many, many domains. And we've got this fairly narrow vertical in genomics. But from the beginning, it was never just about better, bigger, more open, collaborative genomic research. We were always focused on the fact that if not then, back in 2013, we could see that we were very soon going to become relevant in healthcare. And so what we wanted to do is organize genomic research and its standards in such a way that we could reach into healthcare. And I think back in 2013, we thought it would be one directional from really smart foundational knowledge and understanding of genomic research, and we'd share it with healthcare. And fortunately, that's not the way it's just evolved. We now talk much more about learning health systems and this cycling of knowledge from research into healthcare and then back again. So much more of a cyclical movement of data and of knowledge. Where we're coming from, though, genomic research from the beginning for over 30 years had been international by its nature. It was too expensive to do in any one place, even the richest countries. So the Human Genome Project, the HapMap Project, ICGC, they'd all benefited from international collaboration. On the flip side, as you all know, healthcare is incredibly local, and getting your family practitioner to share information with your local hospital is bad enough, let alone across provincial or state boundaries or across different provider systems. And of course, international puts that even more. So our work is primarily in technical standards, probably 70% of what we do. And then to Andrew's point about you've got to align all these hexagons, about 30% of our work is in ethics and regulation, policy frameworks. And I would say that technical standards tend to get implemented globally without much of a change, whereas the regulatory and ethics frameworks have to be adopted and adapted rather than adopted because of local context, whether that's legal or cultural, societal. I will say over those 10 years, because I've been there from the beginning, it was relatively easy looking back to create an Anglo alliance, US, UK, Canada, Australia, even South Africa. It was relatively easy to do high resource countries that were familiar with genomics. We needed groups like Elixir to help us reach non-Anglo Europe, so the rest of Europe through particularly GDI. We needed other groups to help us reach into different continents. So I would say we're probably just 10 years in, starting to think that we are becoming truly global. Still got a lot of work to do with low middle income countries. Still haven't reached all parts, but we've got a much better cross section of participation. And there's an extra reason why that's important when it comes to genomics. So apart from all the other good reasons for having broad, inclusive participation in research, when it comes to GA4GH and genomics, then I think our genomes on one hand remind us how very much in common we all are, how human we all are as a single race across the globe. But in fact, there are some really, really important differences based on ancestry and migration and adaptation to environment. And those differences, even though they may be small in number, can be incredibly impactful when it comes to looking at human health. The large open databases are massively biased towards North European data sets, and most of the world is underrepresented. Some populations significantly underrepresented, and some of those populations with serious concerns about helicopter science or extractive science and trust for groups like indigenous communities. So I think that those things, which apply to almost every branch of science, have a particular emphasis when it comes to genomics because it is inherently the most identifiable of data sets. If we know your genome, we know not just a lot about you, but we know who you are, as long as we can cross-reference it in a way that other data sets don't. Um, I think just from an organizational point of view, we do have a not-for-profit in Canada called Global Alliance for Genomics and Health, Inc., even though it's a not-for-profit, has a board. The NORMEC is for a not-for-profit, but 96.7% of our activity is actually outside that small legal entity, and it's through host institutes. So we have about 5 host institutes and 6 funders. They are, again, based in US, UK, and Canada. But almost all our activity goes through employees of those host institutes supported by academic grants, and about 20 staff support about 450 active volunteer contributors drawn from 500 member organizations. We actually do no research or hold any data ourselves. So it's all about standards and interoperability and enabling. But we do have 28 driver projects, and those 28 driver projects do genomic research or healthcare implementation at scale. And between them, they've got well over 3 million whole genomes. Whereas when we started 10 years ago, I don't think there were 50,000 whole genomes in the entire world. So this is clearly a field where, as the cost has gone down, the proliferation of genomics has spread, and it has gone into healthcare. What that really does, and our work is organized then into work streams, which I think are fairly similar to your work groups, and communities of interest or communities of implementation. So the actual standards work is done in the 8 work streams, and we have half a dozen communities where either needs are identified or implementations are looked into. When we started, there was almost no genomic data in the cloud. NIH prohibited genomic data in the cloud. But as the data has got more and more genomics and more and closely linked to clinical, phenotypic, multi-omic, multimodal data, the data is too big to move around the planet, to export, to download. So the model has shifted to data visiting, as it has in many fields, rather than data download. Because of the nature of the data, that typically now there's a big emphasis on trusted research environments with appropriate rules and structures. The data is also too sensitive, and the more it gets health data, the more it becomes jurisdictional, and people don't want it leaving their country or their state. For me, though, we've got both federated networks. So we move from trusted research environments into federated environments. Some of them are closed formal networks, like Elixir. You're a member of it. There is a clear organization. But more broadly, there's often federated discovery or federated access or federated learning. And so that sense of tight federated networks and then loose ones that come together in time. We have strategic partnerships, including with RDA, HDR UK, Elixir. And as we get closer to healthcare, those partnerships become ever more important. So increasingly, healthcare being much bigger than research and certainly much bigger than genomic research. So we cannot expect healthcare writ large to adopt GA4GH standards if they don't map to and align with HL7, HL7 Fire, ISO standards, CDIS standards on the pharma side. So I think as we've now got 40 or 50 products that we've developed, the emphasis becomes not only what are we pushing out as new standards or improving the way they work, but how do they interact with other groups? OMOP, SNOMED, some of the clinical ontologies. I think in common with many, many global groups at the moment, the biggest challenge we face is sustainability and funding, and particularly since some of the traditional sources of sustainability are not as accessible as they were. But we're very glad that we diversified our funding, because if you had asked me a year ago, my biggest challenge was in Canada, and now my biggest challenge is in the US. And who knows, in 3 years, it might be in the UK, but at least we don't have all the eggs in one particular basket. So diversification in that sense has been really good for us. And upcoming, we have a plenary Connect meeting next week in Boston. That's very much an internal working meeting. And then our next open plenary is in Uppsala, Sweden in October. And it will be great to see some or all of you at one of these meetings. Oh, no, not Boston. It's closed. We're already at capacity. But Uppsala is still wide open and it's nice. So Shelley, that's it. That's my lightning in. I think I hit my 10 minutes.